Well, hey guys, in today's video, I'm going to be answering more of your skincare questions. And today's video is all about sensitive skin. I get tons of questions here in the comments of YouTube videos, over on my Instagram, and then on my TikTok, all about the sensitive skin issues of burning, stinging, how to incorporate different products if you have sensitive skin, what products are good, which ones to avoid, and how to address certain skin concerns in a background of sensitive skin. Today's video is in partnership with Avene, and later in the video, I'm gonna be talking all about their tolerance control line, which is a really great line of products for those of you dealing with sensitive skin. Number one, what is the best exfoliant for sensitive skin? All right, I would say this, ask yourself, do I really need to be exfoliating? The reason I say that is because marketing and social media puts this pressure that we all need to be exfoliating. You need to be exfoliating, exfoliating, exfoliating. And that actually can lead to symptoms of sensitive skin, burning, stinging, and truthfully, your skin exfoliates naturally on its own. Now, of course, as we get more mature or with certain skin conditions, the rate at which that happens slows down, and we can use a little help from a exfoliant. When we think about exfoliants, there are chemical and physical exfoliants. I always advocate choosing a chemical exfoliant over a physical because they are more precise. And physical exfoliants can be kind of traumatic to the moisture barrier. So if you've decided that you would benefit from a chemical exfoliant, I would suggest a polyhydroxy acid. Unlike other hydroxy acids like alpha hydroxy acid and beta hydroxy acid, polyhydroxy acids are much larger, so they don't penetrate the skin as deeply, and they're not as aggressive, if you will, in terms of exfoliating. Incorporating a polyhydroxy acid into your skincare routine can not only help smooth out the surface of the skin, exfoliate away heaped up patches of dry, built up dead skin cells, it also can accelerate the rate of clearance of hyperpigmentation or post-inflammatory hyperpigmentation. Polyhydroxy acids are also antioxidants, so they may help in reducing oxidative stress that would otherwise damage proteins in your skin cells and your skin DNA. They go by the name gluconolactone, lactobionic acid, zinc gluconate, and generally speaking, they are very well tolerated by people with sensitive skin. Number two, I get this question all the time. Why does insert your favorite product sting? This is a common manifestation of sensitive skin. By definition, sensitive skin refers to unpleasant sensory experiences when your skin comes in contact with things that are otherwise innocuous. That can be skincare products like your favorite cream, or it can be something as benign as just plain water. Water actually can cause these symptoms for a lot of people. Air, wind, and don't forget, UV rays from the sun can elicit these symptoms as well. Someone may have sensitive skin due to external factors, their environment. If you live in a really dry climate, your skin is more likely to be sensitive. You may notice that it becomes more sensitive in the winter. Things that you're putting on your skin may be stripping away at the moisture barrier, allowing for more irritating things to get into your skin, causing these symptoms. Or it may be something that you're exposed to in your environment that has nothing to do with skincare products. Occupational exposures, like people who work in a kitchen, you're exposed to a lot of steam, maybe cooking spices condense onto the surface of the skin and cause some irritation, making more sensitive. And then of course you have things that are specific to you and have nothing to do with your environment. We can always blame our genetics and our hormones. And certain skin conditions like eczema, rosacea, and acne can be accompanied with sensitive skin. In order to understand why it is that you have sensitive skin and you get these symptoms, you've got to understand the two key aspects that underscore sensitive skin. The first is an impairment in the skin barrier. What that then leads to is more water loss out of the skin and more irritating things getting into the skin. The second aspect is neurosensory changes. There are little tiny nerves that go through our skin, and they are there and they respond to things that come in contact with the skin. But in people with sensitive skin, they are hyper responsive. There are these little channels on the skin nerves called TRPV1 or TRPV1 channels. These channels respond to things like heat and pH changes. And then subsequent to that is the generation of a type of inflammation in the skin called neurogenic inflammation. And that can lead to dilation of the blood vessels with redness, that sensation of heat or warmth, itch, and other unpleasant sensations. So when you're trying to address sensitive skin, the goal should be to break this neurogenic inflammatory loop of those hyper responsive little nerves generating all this inflammation. And then you also need to address that skin barrier alteration. You can't change things like genetics or hormones, but you can control your external environment to a certain extent, and specifically, you can control the types of skincare products that you're using. Fewer number of products, fewer problems. A good skincare routine for someone with sensitive skin should include a sunscreen, of course, to protect you from those UV rays that damage your skin and make you even more sensitive to things, a gentle cleanser, and a moisturizer, and in some cases a moisturizing balm to really protect the skin. Now I'm going to tell you about Avene's Tolerance Control line and why it is a great choice for those of you dealing with the symptoms of sensitive skin. From the Tolerance Control line, you have the Extremely Gentle Cleanser, you have the Soothing Skin Recovery Cream, and the Soothing Skin Recovery Balm. The products in the Tolerance line have a trademark postbiotic called D-sensinose that is calming and helps with skin barrier recovery. This postbiotic comes from Aquaphilus dolomianae, which is a bacteria found in the Avene thermal spring water. This postbiotic helps to decrease the symptoms of sensitive skin by blocking the sodium influx into those little trip channels into the little skin nerves. And remember, I told you that earlier that was a major part of what generates that neurogenic inflammation that kind of gets into a vicious cycle for people with sensitive skin. So it goes directly to work at that location, and that is how it helps. And it also helps to restore the moisture barrier. They're formulated to mimic your skin's composition, and they deeply hydrate and help with skin barrier restoration. The other thing about the Avene products is that they are in sterile, airless pumps, which allows them to formulate these products without any preservatives. Now, preservatives, as I mentioned in numerous videos, are not bad. They're actually very good. However, for people with sensitive skin, different preservatives actually sometimes can be a culprit in causing those symptoms, whether it be parabens or phenoxyethanol. Dirt, impurities, and cosmetics left on the surface of the skin can definitely be a source of irritation and can further impair the health of your moisture barrier. How do you remove that? Well, you want to use a very gentle cleanser, because remember from my videos on cleansing that over cleansing or using harsh cleansers can further strip away at your moisture barrier, making you even more sensitive. I really love their Tolerance Extremely Gentle Cleanser, but they have reformulated it, and it's even better now because they have that trademark postbiotic, the D-sensinose. So that's going to directly address those issues with the trip channels. This is a no rinse formula actually, so you can use it to remove your makeup and wipe it away without needing more water that in some cases may be a culprit in terms of causing burning and stinging. Rather than stripping away at that lipid barrier, it actually helps to restore the moisture barrier and reduce dryness and soothe those symptoms of discomfort. And then a moisturizer is a really important piece of your skincare routine when you're dealing with sensitive skin, because it's going to help reduce water loss out of the skin and help act to protect you from irritating things getting in. The Tolerance Control Soothing Skin Recovery Cream is a nice lightweight cream. So if you are someone who heavy creams make you feel hot, and that's part of your sensitive skin symptomatology, this is wonderful. It's very lightweight, it's very hydrating, and has been shown to alleviate those symptoms within 30 seconds of application in their clinical studies. I also mentioned that using a balm may be a useful addition. Balms are a lot thicker than creams, and in some cases you may find that you have a particularly sensitive area, maybe around your eyes, maybe your cheeks. The cheeks tend to be some of the most sensitive skin because they have more blood vessels. So at those locations, you may want to use something that is thicker to really trap in that hydration and help with barrier recovery. The Tolerance Control Soothing Skin Recovery Balm, it's a lot thicker in consistency. It has a lower percentage of water overall. These products offer several advantages to people who are dealing with sensitive skin. First of all, they are 100% fragrance-free. There's zero fragrance in these products, and fragrance, as I've said in my videos, it's commonly irritating to all skin types, but in particular if you are dealing with sensitive skin. And a lot of fragrance compounds actually can be vasodilators, so they can worsen redness. These products are also a great choice because they have that postbiotic trademark D-sensinose, which is directly going to address that neurogenic inflammatory component of sensitive skin, as well as skin barrier recovery. These products are safe for children 2 years of age and older, and then of course adults. They're approved by the National Eczema Association, and they've been clinically shown to offer immediate as well as long-lasting relief from sensitive skin. I know a lot of you guys deal with this. Most of my following is women, and over 50% of women in the US report having sensitive skin. All right, number 3, I have really sensitive eyelids. Any tips? Reasons for sensitive eyelids can include the fact that the skin there is really delicate and just more prone to irritating things getting in, and water loss, more prone to dryness. Regardless of your skin type, if you have sensitive skin or not, that can be the case. But people who have sensitive skin at baseline, the eyelids are often a site that is affected. You have to be aware of all things that could be coming in contact with your eyelids. It's going to be more than just things that you put directly on your eyelids, because we're always touching our face, and things that we touch with our hands get transferred to the face, and the skin around the eyelids is most vulnerable to those things that could be irritating. One thing people don't realize is that something like nail polish actually can end up transferring to the eyelid skin and being a source of eyelid dermatitis. Also, if you use a lot of scented lotions and things, that fragrance can then be transferred to the delicate skin around the eyelids, cause problems. I mentioned cooking in a kitchen earlier. If you chop up garlic, spices, and then you touch your eyelids, that can lead to symptoms of sensitivity on the eyelids in particular. Don't forget hair care products. They can migrate and affect the eyelids. In order to minimize exposure of the delicate skin of your eyelids to these irritating things that contribute to eyelid sensitivity, I suggest applying an ointment or a balm to act as a skin protectant there. This will reduce the penetration of anything irritating that may settle on the skin of the eyelids there. Many skincare products that you use on your face, which are well tolerated to other areas of your face, they actually can transfer and be too irritating to the delicate skin of the eyelids. So applying a balm or an ointment to that area prior to using your other skincare products can reduce the transfer of those irritating compounds to the delicate skin of the eyelids. Number 4, can I use a retinol if I have sensitive skin? You can. You just have to be mindful that when starting a retinol, everybody in the beginning can experience more symptoms of sensitivity. Even if you don't have sensitive skin, because it increases skin cell turnover, you go through a period of time called the retinization process. That is a time when the skin is getting used to it, and you're more likely to have symptoms of burning, stinging. You're going to experience some dryness. So if you have sensitive skin from the get-go, don't think that, oh, this is not for me, I can't use this. It's more about how you introduce it into your routine. In the description box, I'm gonna list a video that I put out a while ago all about how to get started with a retinol if you have sensitive skin. So I want you to check that out, but the short answer, yes, you can use one. It's just about how you introduce it. Slowly, conservatively, and addressing the needs of the moisture barrier with a moisturizer. Are there any ingredients that I should avoid because I have sensitive skin? This is a great question because there are some ingredients that are more likely to cause problems for people who have sensitive skin. Of course, sensitive skin is a very individualized thing, so it's not like the things I'm going to mention here are 100% guaranteed problematic. You may have sensitive skin and have no issue with these, but they are common offenders. Menthol. Menthol is present in a lot of skincare products that are meant to maybe alleviate itch or to have a cooling effect. You'll find them in a lot of masks, But menthol causes vasodilation of the blood vessels in the skin, and that actually can worsen that neurogenic inflammation. So if you've got really sensitive skin, I would definitely encourage you to stay away from menthol. Of course, fragrance in skincare products, not only can it be irritating, it can act as a vasodilator, worsening that redness. Fragrance also is a common allergen, and so you may be allergic to it. Be mindful that some preservatives can be more problematic for people with sensitive skin. You may find that they're just too irritating. They give these symptoms of burning and stinging and irritation. Parabens, for some people, parabens do cause those symptoms. For other people, it might be phenoxyethanol. That's more up to the individual. I would not say strictly avoid those, though, unless you find that they are a common offender for your symptoms. Make sure you don't have a lot of redundancy in your skincare ingredients. By redundancy, I mean read the ingredients on the products that you're using. If you find that you're using a couple of products that have the same ingredient over and over again, that may be too much. For example, a lot of people find that niacinamide becomes problematic. They start using a niacinamide serum. They don't realize that their face wash has niacinamide, their moisturizer has niacinamide. It just becomes niacinamide overload, and that actually can end up being pretty irritating. Same thing with the different forms of vitamin C. A lot of people use a vitamin C serum, but maybe their moisturizer has that type of vitamin C in it, and it just becomes too much for you if you have sensitive skin in particular. Are there any supplements that you would recommend for people with sensitive skin? No, dietary supplements, they haven't been shown to benefit symptoms of sensitivity. There are some dietary supplements that may help the health of the moisture barrier, which I guess you could, extrapolate that into helping reduce symptoms of sensitivity, although there are no studies. These supplements include oral collagen, oral hyaluronic acid, and oral ceramides. I have videos on all three of these, which I'll list down below in the description box. The data are pretty limited to sparse, and none of these studies specifically really look at the symptoms of sensitivity. So that is a stretch. But overall, I don't suggest any specific dietary supplement, and never start taking a dietary supplement without first talking to your healthcare provider. They can interact with medications and things like that. Now, speaking of dietary supplements and sensitive skin, one thing that can cause sensitive skin that's a dietary supplement is oral vitamin A. Some people take a vitamin A supplement, and that actually can make your skin very sensitive. It has this, taking unnecessary amounts of vitamin A really can dry out your skin a lot. I live in a windy, cold place. Winter is coming. Any tips for windburn, which makes my sensitive skin go nuts? Yes. Rein in fabrics like thick gloves for your hands, a nice thick scarf to protect your face and your neck. Obviously when you live in a cold, windy place, you're wearing long sleeves and long pants. Those things can help. Your face, like your nose, for example, employ an ointment or balm to act as a skin protectant from those harsh winds that really can dry out your skin quite a bit and really aggravate those symptoms of sensitivity. Any tips for sensitive, acne-prone skin? I'm trying to use my acne treatments, and they're very drying and making my sensitive skin worse. Yes, moisturize, moisturize, moisturize. And the moisture sandwich can really be beneficial in this situation, where basically, if you're using an active ingredient to treat your acne, like a retinoid or a salicylic acid or benzoyl peroxide, use it after applying first a moisturizer to clean skin. Allow the moisturizer to absorb, apply the active ingredient, allow it to kind of absorb, and then apply another layer of moisturizer. That will help in addressing the barrier issue, and it also will help in reducing neurogenic signals. What is the best way to remove hair if you have sensitive skin? This is tricky because hair removal can really aggravate symptoms of sensitivity for people. If you shave your face, you know this firsthand. If you wax or pluck, all of these things, they take away some of your lipid barrier and they leave the skin vulnerable to irritation, symptoms of sensitivity. One of the best ways to remove hair that removes this issue is laser hair removal. The other option is a prescription called Vanica that can reduce hair. Now, it doesn't completely eliminate it, but this is a good option for people who have, for women in particular, who have hirsutism, which is hair growth in a male pattern on the face, for example, or the neck. Vanica can help reduce the amount of that. Vanica can be irritating though. So if you're sensitive and you try Vanica, you may find it's one of those things that aggravates your symptoms. And then you have chemical depilatories. If you use those, make sure you follow the directions to a T, because if they are left on the skin too much, they can really cause a burn and definitely will aggravate your symptoms of sensitive skin. So be careful with the depilatories. If you're gonna try one, I suggest doing a test spot first before doing like, you know, your face for sure, or anywhere in your body where you have sensitive skin. Be very careful. And after you rinse them off, make sure you rinse them off in completion. That way you don't have any left behind on the skin that then goes to work at chewing up at your moisture barrier. If you're gonna shave, one thing people always neglect doing when it comes to shaving is they end up shaving, rinsing the skin off, and then they don't moisturize. That is a great opportunity to reduce water loss and to help with barrier recovery after shaving. The act of shaving is going to strip away some of your natural lipids and whatnot, some of your natural moisture barrier. So don't neglect that moisturizer piece. And if you need to, use a balm. Use a balm that's more of a skin protectant after you shave to really trap in that water and really protect the skin from water loss and from irritating things getting in. And then last but not least, what is the best sunscreen for sensitive skin? The best sunscreen is always the one that you actually will use, but when you have sensitive skin, some sunscreens can lead to those symptoms of burning, stinging, especially around the eyes. For people with sensitive skin, I always suggest they try a mineral sunscreen with zinc and or titanium dioxide as opposed to a chemical sunscreen. Mineral sunscreens, they sit on the surface of the skin, they kind of form a film, and that's where they work. Whereas chemical sunscreens, they can those ingredients can be a culprit in symptoms of redness, burning, and stinging. But I want you guys to understand this. If you have sensitive skin, that doesn't mean that chemical sunscreens are off the table. For some people, it's specific filters in the chemical sunscreens. Oxybenzone, for example, is a common culprit in symptoms of sensitive skin from chemical sunscreens. I have a video all about allergy to sunscreens that I'm gonna link down below, and I talk about some of the most common offenders for irritation and allergy in chemical sunscreens. But if you do have sensitive skin, or you have one of these conditions that I mentioned earlier that predisposes you to sensitive skin, eczema, rosacea, acne, don't believe that chemical sunscreens are off the table. And I say that because the mineral sunscreens, they do leave that white cast. Chemical sunscreens don't leave a cast. But if you believe in your mind that because you have sensitive skin that you're like not allowed to use chemical sunscreens, and then you're left with a mineral sunscreen that leaves a white cast, especially if you have a deeper skin tone, well then that's a barrier to protecting your skin from the sun. And you really need that sunscreen piece in your skincare routine because it's those UV rays that further damage your skin and leave it more vulnerable to those irritating things getting in, make you more sensitive. So the sunscreen is an important piece of it, but when it comes to picking one that's not gonna aggravate your symptoms, try a mineral sunscreen. Those tend to be easier to tolerate. If you find that you don't get along with chemical sunscreens, but you try a mineral sunscreen and the cast is just not pleasing to you, try a combination sunscreen. What is a combination sunscreen? It has zinc in it and it also has some chemical filters. It doesn't have 0 cast, but it has a negligible cast in comparison to an all mineral. And it has fewer chemical filters that might be the culprits in some of your symptoms. So it's kind of, somewhere in the middle. So don't forget those. I think those can be a good option too for people who have very sensitive skin and find that purely chemical sunscreens are just too much and too irritating. But that purely mineral sunscreens are just too casty. All right, guys, those are some of the most common questions that I get about sensitive skin. I hope this answered them for you in a way that, was enjoyable. Don't forget to check out Avene's Tolerance line. Thank you, Avene, for sponsoring this video. I will list all of their products in the description box. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.